Hi, my name is Kaylee Entrup. I'm the speech-language pathologist here at CWI. I'm going to be talking to you about communication disorders. I'd like to share the American Speech-Language Hearing Association's definition of a communication disorder. A communication disorder is an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbol systems. A communication disorder may be evident in the processes of hearing, language, and/or speech. A communication disorder may range in severity from mild to profound. It may be developmental or acquired. Individuals may demonstrate one or any combination of communication disorders. A communication disorder may result in a primary disability, or it may be secondary to other disabilities. So here's a list of the major types of communication disorders you're likely to see. Speech sound or articulation disorders, receptive and/or expressive language disorders, so understanding or use of language, fluency disorders such as stuttering, aphasia, which is a neurological disorder due to a variety of events, stroke being the most common, where there is brain damage which results in difficulty with reading, writing, speaking, word finding, and comprehension in varying degrees, and there are several different types of aphasia. Social communication disorders such as autism spectrum disorders. There are two different types of motor speech disorders. One is dysarthria, which is where speech is difficult to understand due to neurological issues, muscle weakness, or paralysis such as in cerebral palsy, and apraxia of speech, which is difficulty with motor planning. So if you want to think about it in a sense that someone may know what they want to say, but they're not able to send that signal from the brain to the mouth to get out what they want to say. So for example, it's like if you're trying to turn left in your car and you accidentally hit the hazard lights instead. So they're just not getting out what they want to say, which can be very frustrating. The last major type is voice disorders, and this could take the form of abnormal voice quality, loudness, and pitch. Medical diagnoses can often be major contributing factors or maybe the causative factor of a communication disorder, including intellectual disability, Down syndrome, hearing loss, etc. This is a non-exhaustive list, but there are several diagnoses that can either cause or result in a communication disorder. The first one being to speak slowly and clearly, but not condescendingly. The individuals that we work with are adults, and they should be treated as such. Speak to the person, not about them, and include them in conversations. So if you have the individual you're working with sitting next to you, and you have another staff member that you're talking to, and you're talking to them about the individual, try to include them in the conversation as much as possible. No one likes to be talked about while they're in the room as if they're not there. The next one is very important as well. Only speak loudly to those with hearing loss, and always ask the person if they have hearing loss, if you're loud enough, too loud, etc. Oftentimes people falsely assume that because a person has one disability that they have other disabilities. So for example, if you see someone with a white cane, if they have a visual impairment or they're in a wheelchair, a lot of times people will speak loudly to those individuals when in reality they have a different type of disability. They don't have hearing loss, so you don't need to speak loudly to them. Keep that in mind. The next one is ask simple, clear questions, and don't ask long, drawn-out questions, especially if you're finding that this person isn't understanding what you're saying. Try to simplify, rephrase if you can, and if the person responds to questions inappropriately, especially WH questions like what, where, who, try to emphasize the WH question. So for example, who did you see today? Or what did you want for lunch? And don't start out by emphasizing it. You know, you don't want to be condescending again, but if the person is having difficulty or if they're responding in an irrelevant manner, that's something that you can try. The next one, give simple, specific directions and use concrete words. And this is very important, especially with individuals on the autism spectrum, oftentimes they have difficulty understanding very abstract language. So rather than saying something like, get ready, try something like, put your coat on, and see if you have a better, more successful interaction with that person and that they're understanding what you're saying. And always give choices when possible. So, choices are extremely important in aiding in the person's feelings of autonomy and independence. So whenever possible, which most of the time it's possible, give a choice. Say, do you want to wear the green shirt or the red shirt today? Or if there's two things that need to get done, try to give a choice regarding what they want to do first. So do you want to brush your teeth first or brush your hair? Some other communication tips. Don't try to finish sentences. Think of how you feel when someone interrupts you, or you think that, or they think that they know what you're going to say, and they cut in, or they try to finish what you're going to say. It's very frustrating. Give the person time to finish speaking. And on the other hand, allow time for individuals to process information and to respond. A lot of the people that you work with, they have difficulty with processing language and understanding language. So just be patient. A good rule of thumb, if you have difficulty with this and you're immediately like, if you say something and they're not immediately responding, don't immediately repeat yourself or expect a response. Try to count to 10 to 20 seconds before prompting to respond. And actually, I know a few people who sometimes it takes even a couple minutes before I would expect them to respond, and you'll just have to get to know who you're working with. Okay, so some more specific communication tips. This list is more geared towards those with hearing loss. As I mentioned before, ask the person if your voice is loud enough, but don't shout. People with hearing loss, and especially those who wear hearing aids, it can be painful to them if you're shouting at them. You can turn up the volume, so to speak, on your voice, but make sure you're checking with them that it's loud enough, or if it's too loud, try to just make adjustments. Make your face visible. As many people with hearing loss rely on lip or speech reading, try to make sure that there's good lighting so that the person can see your face. Speak in a quiet area if possible. Use shorter sentences. Pen and paper may be necessary, especially with those who have very severe hearing loss. And if the person wears hearing aids and they're still not hearing you, ask them if it's turned on, and check to make sure it's on or that the battery isn't dead if necessary. Many of the individuals that we serve require the use of what's called Augmentative and Alternative Communication, or AAC. And one definition of this is utilizing any and all available means of communication to supplement or replace natural speech in order to communicate in the most efficient and effective way possible. And this can take the form of verbal means or nonverbal. And it's important to point out that people can use AAC to supplement, so people who are verbal can also benefit from use of AAC, or replace in the case of a very severe communication disorder where a person is nonverbal, for example. So in the case of an individual who's nonverbal, speech is not always the most efficient or effective means of communication. So you're really going to need to pay attention to nonverbal means in general, but more specifically and more importantly with those who are nonverbal. So for example, eye gaze, pointing, gestures. Does a person have communication boards that have been previously made that you can refer to help with the interaction, or a visual schedule to keep them on task and to preset them and let them know what's happening next. Some people have what are called communication devices, or a speech generating device, which is a high-tech device used for communication. Oftentimes there's speech output, so if a person pushes a button, it will say, I need help, for example, or it has wants, needs, social greetings, all sorts of things on there. So make sure that you're, if you know the person, or if you don't know, find out what means they use for communication. Find out if it's more than just speech, or if they don't have speech, what are they using to communicate. I want to point out that a lot of times behaviors that you observe may be communicative or as a result of frustration from not being able to communicate effectively. And one of the things you can do to help is write this information down and make sure that you're communicating with other staff at the house, at Dayhab, or just professional staff, including behavior specialist and speech language pathologist, and write down, what happened before the behavior, what was the behavior, what happened after the behavior, and are you noticing a pattern? Is it during a certain time of day that you're noticing this behavior? What's going on around you? I really like this quote: not being able to speak is not the same as having nothing to say. So just because a person can't speak or has very limited verbal output doesn't mean that they're not communicating something to you. Okay, so here are some tips on repairing communication breakdowns when they occur. And what I mean by communication breakdown is if you're talking to someone or they're talking to you and one or the other has difficulty with what's being said, and it's just you don't know what they're trying to say, and it gets very frustrating very quickly. I'm sure everyone has been in a situation where they've been asked to repeat themselves a couple times, and after a couple times it's like, never mind, kind of thing. Communication breakdowns can be very frustrating for people who don't have communication disorders. For people who have communication disorders, it can be even more frustrating because a lot of times they don't have the tools available to them, or they're not able to express what they want in a way that conveys, what exactly they're trying to say. So some things you can do. Encourage the use of any means of communication available to the individual. So this is what I mentioned before. If the person has a communication device, if they have a communication board or a picture schedule, if they can write, using pen and paper can be really effective. Ask him or her to show you really anything that's going to help. And if the communication breakdown isn't resolved after one or two tries, or when the individual seems to be really getting frustrated, just acknowledge the breakdown, say, I'm sorry, I still don't understand, and try to move on to something else and revisit it later, if possible. You can repeat back what you understand, or what you think you understand. So you can also ask the person to repeat what you said so that you're checking for understanding and you know that they know what you said. Ask specific follow-up questions. Ask yes/no questions if the person's having difficulty responding to your follow-up questions, but never pretend to understand if you don't. This is really crucial. I don't like it if I say something to someone and I can tell that they really didn't hear what I said or they didn't get it, and you can kind of see the look on their face and they're just like, okay, and you know that they don't understand what you said, but they just kind of don't want to address it. That's really annoying. Don't do that to people. If you don't understand, let them know, like, I'm sorry, I don't know what you're saying, or say something like, I heard you want pizza for lunch. Is that right? So this brings us to the last bullet here. Try to avoid saying like, what, or huh? That's not really helpful. You're not really going to get too much information by asking that, especially if someone said a really long sentence. I doubt they're really going to want to repeat themselves, so just try to repeat back what you think you heard, and that way you're establishing some context and you can hopefully get some more information and resolve that communication breakdown. Okay, so some key points I'd like you to take away from all of this. The first one being that the most efficient and effective communication strategies are individually based. There is no one-size-fits-all situation, and some strategies that were successful with one person may not be useful or appropriate with another person. So it's really, a troubleshooting type situation and really a team-based approach. I, for one, rely a lot on staff to let me know when the individual is having difficulty with communication, how are they communicating, or what behaviors are you noticing, and are their communicative attempts successful? Are they effective? Or not so much? What have you tried, and what's been helpful and not so helpful? And always remember that all behaviors should be viewed as communicative attempts. So just because, like I said before, just because someone can't speak doesn't mean they don't have something to say. Really, anything from pounding your fist on the table to spitting out food to vocalizing loudly, they all are communicative in nature. Okay, I just wanted to share some communication quotes with you that I thought were really powerful. I will let you read those on your own, but I just wanted to really drive home the fact that communication is it's a basic human right, and it's the way that we navigate our world, and really how people maintain independence. Actually, I will read the middle one though on here, because this one I feel like is the most powerful of all. It's by Daniel Webster. It says, "If all my possessions were taken from me with one exception, I would choose to keep the power of communication, for by it I would soon regain all the rest." And that I think is really powerful, because if someone, say there's someone who's nonverbal and they can't, and they're also paralyzed, and they can't communicate at all, other than maybe say that they can move their eyes. Okay, so in that case, they would be able to use their eyes to look at a communication board to show you that they need to use the bathroom, or that they're hungry. So really, I mean, even if someone, there are no prerequisites to communication. Even if someone is completely paralyzed and they have intellectual disability or what have you, being able to communicate is one of the most important things, I think, to increasing independence. Okay, and lastly, I just wanted to share the National Joint Committee for the Communication Needs of Persons with Severe Disabilities Communication Bill of Rights. This has a list of rights that was established by multiple disciplines, including physical therapy, occupational therapy, speech pathology, etc. And I'll just read the top part. You can read the rest in your handouts. It says that all people with a disability of any extent or severity have a basic right to affect, through communication, the conditions of their existence. Beyond this general right, a number of specific communication rights should be ensured in all daily interactions and interventions involving persons who have severe disabilities. And then it just gives the list of rights, and I'm going to wrap this up now. I hope that you found these tips to be helpful.